is Regina. I'm a pharmacist at NewYork-Presbyterian Queens Hospital, and I'm here to talk to you about signs and symptoms and causes of hypoglycemia. In this presentation, we're going to learn what hypoglycemia is. We're going to discuss signs and symptoms of hypoglycemia, the risk factors and causes of it, and what the consequences of hypoglycemia are. We're also going to go over a patient story. So hypoglycemia is defined as low blood sugar. Blood sugar, which is glucose, is used for energy. It's defined as blood sugar or glucose less than 70 milligrams per deciliter. It's the greatest immediate danger for diabetes and must be treated immediately. In this slide, you could see that the hypoglycemia happens gradually. The sugars can drop anywhere between 70 all the way down to 0, depending on the patient's history, depending on how long the patient had the diabetes and how long he's been experiencing hypoglycemia. This slide can be more rapid decline or a little bit less rapid decline. But there is early symptoms of hypoglycemia and more severe symptoms of hypoglycemia that need to be recognized. Some of the early symptoms include hunger, racing pulse, headaches, pale skin, sweating, trembling, dizziness, blurred vision, confusion, irritability, anxiety, and weakness, where more severe symptoms include poor coordination, poor concentration, patients can pass out, they may develop seizures, they can feel numbness in the mouth and tongue, they can develop nightmares or bad dreams at night, and they can actually fall into coma, and this can cause death. So these symptoms are very important to be recognized by the patient, and if you have a family member with diabetes, it's important for you to learn the signs and symptoms of hypoglycemia, so you will be there to help your family member if they're experiencing hypoglycemia. So as we mentioned, some of the symptoms are bodily and some are cognitive. So your bodily reactions include sweating, shaking, hunger, pale skin, headaches, and racing pulse. And your cognitive behavioral changes will be your confusion, your slurred speech, being anxious, visual disturbances, dizziness, seizures, poor coordination and concentration, and as I mentioned, it can cause death. So these are the pictorial explanations of the symptoms. Some people prefer to print them out and have them as little cards so they can point to it, what they're feeling. If they're not able to verbalize what they're experiencing, this would be a good way of pointing out how they feel. The biggest issue with hypoglycemia is when it happens at night, because while sleeping, we are not realizing what's happening to our bodies. So how do we recognize hypoglycemia at night? When you wake up, if you wake up and your clothes are wet or damp sheets, you obviously sweat at night. If you see nightmares, if you're crying out during sleep, if you wake up tired, irritable, and confused, all of that can be symptoms of hypoglycemia. And your physician, again, discuss it with your physicians, and your physicians may ask you to measure your blood sugars during night. Literally wake up in the middle of the night and measure them just to see if the sugars are dropping during the night. It's very important to keep track of all that and communicate with your healthcare professional, because if you're experiencing any of the symptoms, the medications or medication schedule may be adjusted to help you and prevent hypoglycemia. So as we mentioned, there is gradual hypoglycemia symptoms that may cause severe hypoglycemia. And severe hypoglycemia is defined as blood sugars below 40. Clinically significant hypoglycemia is anytime blood sugars drop below 54. That would be your diabetic emergency. In this case, the patients would actually require an outside help, and they will require another person, a relative or healthcare professional, to help them treat their blood sugar and make sure they don't fall into coma and obviously don't cause any death. The severe hypoglycemia, usually the symptoms would be vision changes, weakness, fatigue. They have very hard time focusing or paying attention. They're confused. They're drowsy. They have memory loss. They may even lose consciousness and develop seizures. Why is it important to know of hypoglycemia? The patients that have diabetes, and they have diabetes for more than a few years, they may become unaware of hypoglycemia, and that way they will miss the signs and symptoms that your body is telling you, I'm experiencing this, and they may not react until it's too late when the blood sugars drop too low, and then they require emergent healthcare intervention to help them deal with hypoglycemia. So people that do not feel the symptoms are usually elderly, people that experience frequent episodes of hypoglycemia, people that have type 1 diabetes, because usually that's the diabetes that you develop when you are still a child. They've had this diabetes for a long time. They're used to their symptoms. They're not very in tune to their body responding. Diabetes causes damage to the nerve. Again, you may not feel your body's response as well as the normal person. And then taking some medication that may actually hide and block some of the symptoms. So, for example, beta blockers that are being taken for blood pressure control, they also decrease heart rate. So you may not feel that your heart rate is starting to race, and they will block that particular response of your body, and you may not realize that you are experiencing drop of sugar. So it's very important for diabetic patients to monitor their blood glucose frequently, and they also need to consider to wear a medical alert. Like I said, if they lose consciousness, if they become too confused, the people around them will be aware that this is a diabetic patient and he may be experiencing hypoglycemia and will be able to help the patient. What are the causes of hypoglycemia? Some medications, unfortunately, when we try to treat high blood sugar, we may overshoot and develop hypoglycemia, which is low blood sugar. Some of the medications that we use for treating diabetes are known to cause hypoglycemia if the patient's dose is too high or the patient's schedule changed and they didn't eat right after they took the medication. So, for example, sulfonylureas is a class of drugs that are being used to treat diabetes, such as glyburide, glimepiride, and glipizide. Out of these three drugs, glyburide is the one that's associated with the most hypoglycemia chances. Insulin, depending on the type of insulin. The newer insulins are associated less with hypoglycemia, whereas compared to NPH, which is older insulin and it's intermediate action insulin, patients develop hypoglycemia with NPH insulin more often. So newer insulins such as Tresiba, Levemir, or Lantus, they cause less hypoglycemia, and the prescriber may choose to use this kind of insulins if the patient is not responding well to the NPH insulins. Some other medications that are associated with hypoglycemia are other drugs, again, used to treat diabetes, such as Prandin or Starlix, but also, as I mentioned, your blood pressure medications, such as beta blockers and ACE inhibitors, may cause a drop in glucose. Also, antibiotics, such as fluoroquinolones, Levaquin, and Cipro, they may actually cause hypoglycemia as well. So it's very important that your physicians know that you are diabetic and you need to monitor your blood sugars often, especially whenever you start on a new medication, so that you can see how your body responds to that medication, even though that medication may not be for diabetes treatment. What other causes of hypoglycemia? Meals. So whenever you're not eating, you're skipping meals, or you're eating less, you're on a diet, or you're trying to delay the meal because of whatever reason you want to go out with friends, or you didn't eat enough carbohydrates because you're on a new diet, that can all affect your body's response. So again, by monitoring your blood sugars more often and communicating with your healthcare provider, you will be able to come up with a better way of managing your diabetes and avoiding hypoglycemia. Some illnesses are associated with dropping the sugars as well. If you're hospitalized, if you develop cold and flu, if you have liver or kidney disease, that can also affect your body's response and you may be dropping sugars. Alcohol use is associated with hypoglycemia. If you start to exercise, how much you exercise, what intensity of exercise you started to do, again, is very important to diabetic patient and monitor your sugars. If you started a diet, if you started the exercise program, just monitor your sugars more often. We recommend to take a finger stick before you start to exercise and after, or maybe sometimes even during, just to see how your body responds to the exercise and if you need to adjust your insulins or your medications. And stress. Stress causes hypoglycemia as well. Some risk factors for hypoglycemia, as we've discussed, using certain medications, being of certain age, elderly patients are more prone to developing hypoglycemia. The number of years you've had diabetes, so how much you're in tune with your body's response, your multiple healthcare conditions, if you develop liver disease or kidney disease, if you become pregnant, if you start changing your eating habits, skipping or making less carbs during your food, that it can all affect. And some conditions are associated with hypoglycemia. For example, if you had gastric bypass or heart transplant, you may have to adjust your insulins and you may have to adjust your doses of insulin just to make sure you avoid hypoglycemia. So, as we've talked about, hypoglycemia is very dangerous. You need to be aware that you're developing hypoglycemia, and you also need to know how to treat hypoglycemia because it can cause more difficult control of diabetes. It can cause poor quality of life. Patients can develop loss of consciousness. They can be going into heart arrhythmias or cardiac arrest. And it's very important that we prevent the patients going into hypoglycemia because it may cause brain damage and death. So we're going to go over a patient story. So this is Mrs. Jones. She's 46 years old and she has type 2 diabetes. She's been diagnosed about 7 years ago. She also has a history of high blood pressure and asthma. For diabetes, she takes metformin, 1,000 milligrams twice a day, and she's also on Humulin 70/30 insulin that she takes 30 units twice a day. She noticed that she's been experiencing low blood sugars at night. And how did she know that? Because she wakes up every night confused and her sheets are soaked in sweat. So what do you think she's experiencing? She's experiencing nighttime hypoglycemia. So she's dropping her blood sugar during the nights. And what can cause that? Timing of her insulin. So she says that she takes her first injection of insulin 70/30 at 6 a.m. when she wakes up, and she takes her second dose at 11 p.m. right before she goes to sleep. What can we do about this? So we can change the time that she injects herself with insulin. So insulin 70/30 is a combination product. It has NPH insulin and it has regular insulin in it. So it should be taken 30 to 60 minutes before breakfast and then 30 to 60 minutes before dinner. If that doesn't work, so if the physician changes her prescription and tells her to give herself injections before breakfast and before dinner, if that doesn't work and she's still experiencing hypoglycemia at night, the physician may choose to change her to a different insulin regimen. Like I mentioned before, newer insulins are more long-acting insulins and they are associated with less hypoglycemia. So changing the time of injection of insulin 70/30 actually helped our patient, and she no longer experiences low sugars during night. So let's just go over what we've learned. So hypoglycemia is the most immediate danger with diabetes. It's defined as blood sugar less than 70 milligrams per deciliter. Symptoms include shaking, sweating, fast heartbeat, anxiety, dizziness, hunger, irritability, headaches, impaired vision, confusion, fatigue and weakness, confusion, and loss of consciousness. There are multiple risk factors and causes of which many of the causes can be prevented. So it's very important to be aware of hypoglycemia and aware of your body's response. The consequences of hypoglycemia can be very severe and the patients may actually die. So knowing the symptoms and how to treat them is the key with diabetes. Thank you, and I hope this was a very useful lecture for patients with diabetes or their relatives.